Good evening, everyone, and thank you once again for joining me for another wonderful Instagram Live. I was thinking about a topic that I thought would be really useful for people, and as an obstetrician, my goal is to give people the best level of care as part of a multidisciplinary team, right through their pregnancy journey. So that sort of not only involves the antenatal period and birth, but the postpartum period and thereafter. And when I speak to a lot of my patients about what the most challenging thing was for them related to the whole sort of experience of childbirth and new parenthood, the thing that comes up sort of very, very frequently is difficulty with breastfeeding. I think a lot of the education that people get while they're pregnant focuses on the birth itself, but it doesn't really sort of dive deep into feeding. And it can be such a difficult time for women, a really vulnerable time, because you're dealing with a newborn, you're exhausted, completely sleep deprived, hormonal, and when challenges are faced with feeding, it can be really, really difficult. And that's why, as part of my sort of care package for all women that I look after, includes a breastfeeding appointment before you even have your baby. And I'm so lucky to have Amber as one of my midwives. Amber is not only a midwife, but she's almost finished her specialty training as a lactation consultant. And she meets with all of my patients at sort of 36 to 37 weeks to best prepare the women who are wanting to breastfeed for that time. Amber is also then involved in the postnatal care of my patients. Normally she actually does a home visit at a week postpartum, but with everything that's happening at the moment with COVID-19, that's all being done via telehealth. But it's really lovely for my patients to have that continuity of care with Amber. So I'm absolutely thrilled that Amber has agreed to join me tonight. This is her first Instagram Live, so I know she's both excited and a little bit nervous, but she is so amazing with this topic that I know she is going to give so much useful information to everyone watching tonight. So I'm going to get Amber to join me now.
Hello.
Hi, Amber. How
Hi,
are you?
I'm good. How are you?
Excellent. Thank you so much for joining me tonight. Have you had a busy day?
Yes, I have. Yes, and yeah, thanks so much for having me. As you said, it's my first Instagram Live, and it's funny. Most weeknights I am educating women, but it's
Yep.
this is a very different way of
It's
educating.
It is. It's a really different format, but a really useful one because we get to sort of speak to so many people at one time, which I think is just
Yeah.
wonderful. As I said, I think this is such an important topic because it really
Sure.
causes a lot of stress and anxiety for those women who are wanting to breastfeed. And I know that you give my patients such brilliant support that I thought it would be a really good opportunity for, a broader community to be able to see tonight,
Yeah.
what a wonderful job you do, and also to provide this sort of education. So I'm really going to sort of ask questions tonight because I'm
Yeah.
not claiming to be an expert with breastfeeding. I've never had to breastfeed myself. I've seen
Hopefully you
a
will
lot of
be
other
after
people do
tonight.
it. Exactly right. But I'm going to let you be the expert tonight. And instead, what
Beautiful.
I thought I could do is just put some questions to you. These are questions
Yeah.
that I commonly get from my patients, and I know things that you go through with them. But I thought,
Yeah.
in a particular sequence, it just sort of leads them through their journey of how to help them with breastfeeding. So, Amber, do you want to
Sure.
start by just telling women how they can best prepare for breastfeeding? I think a lot of women don't do much preparation. They sort of think
Yeah.
it's going to be instinctive, it's going to be easy, but it's actually not. And I think some
Yeah.
women have an easy time with it, whereas other women have a very hard time. But for all women who are saying, I think I want to breastfeed my baby, what can they do to prepare themselves?
Yeah, absolutely. So I truly believe, as you mentioned in the intro, that having that antenatal education is so powerful for women going
Mm-hmm.
into their breastfeeding journey. So by knowing sort of what to expect from their breastfeeding journey, and just having all of that knowledge beforehand, as you said, women tend to do so much preparation on the birth, which of course is so important, but they tend not to do as much on the breastfeeding. And I just go to countless houses doing home visits and they say, why didn't I learn more about breastfeeding? So I really think that by setting themselves up antenatally and doing that education in their pregnancy is super important. And as I said, having that expectation about what life will be like with a newborn is really, really important. And so then as well, then you can set up a postpartum plan. So I'm a huge advocate for a postpartum plan. I think it is so important. So I think by having your partner or your support person really on board with you about, what you're wanting with your breastfeeding, and also for them to have the knowledge as well. So that if the woman's sitting there, quite hormonal, a bit teary, your partner or support person can be sort of your go-to. And as well to know that your baby is going to be feeding super, super regularly. So trying to set up other things that can make your life easier at that time so that you can really spend that time, recovering from birth, on the couch, breastfeeding, holding your baby, all those sorts of things. And I know with COVID at the moment, it's so challenging with the lack of support, but even things like, if it's just doing a huge cook up before you give birth and, having that in the freezer or already organizing your supermarket online shopping, just little things like that as to involve in your postpartum plan is really important. And even sort of seeking, just sort of knowing who you can call upon if you are having challenges. So whether that be, contacting your hospital and saying, once I'm discharged, do you offer any lactation support services, which, some hospitals definitely do. If it's contacting your community, your maternal child health nurse, asking them what services they offer, having some, if private LCs, if they're in your budget, then, and having a go-to person and saying, in COVID, can you do face-to-face if obviously, we're all well. So by having those sorts of plans in place can really take that pressure off before you sort of head into your journey of breastfeeding. And also as well, just having some self-confidence. So your body, your body has made this baby, which is incredible. And yes, it can be so challenging for so many women, but sort of going in with the confidence, and just sort of having that sense of confidence going in, I think can be really valuable as well.
Excellent. Fantastic. Now, I'm going to come to breastfeeding itself very shortly, but I know what you often talk to my patients about when you meet with them antenatally is antenatal expressing.
Yes.
So can you tell us a little bit about what antenatal expressing involves and what the benefits of it are? Are there women who shouldn't be doing antenatal expressing? What's your sort of take on it and your best advice?
Yeah, definitely. So this is something that's really come about in the last couple of years. And I think for the if women are above 37 weeks, and I always encourage every woman to talk to their care provider first. Even I'm always messaging you, like, are you happy for this woman?
Absolutely.
Like, I think it's really important for the care provider who's got the full history to say, is if that's right for them. And then I think it's really important for women to have really good education around the expectations around antenatal expressing. So essentially what antenatal expressing is that your breasts have been making colostrum since really early on in your pregnancy, and it's been sitting there, it's ready to go. And from 37 weeks onwards, you can actually start to do some hand expressing. So it's a hand compression that you do on your breast. We sort of recommend that you can do it from 37 weeks, about 5 to 10 minutes, once or twice a day. And you can actually start doing that stimulation. And I think it's really important for women to know that some women won't actually get any volume out. So they won't actually get anything. And I think that's really important, because otherwise women are like, well, I don't have anything. And, it's there. But sometimes, well, for one, it's a skill. It takes practice. It is a real skill, which is, again, why I recommend practicing it in pregnancy if you can. I remember doing it as a student midwife, and I was like, I swear colostrum does not come out of breasts. Like, it's a really hard skill. It takes practice.
Definitely.
It is really, really challenging at the start. So, again, if you can have someone to show you how to do it, and just knowing that if you don't get anything, it is not going to be a reflection on your milk supply. But again, great that you've been practicing that skill.
Yep.
if you do manage to get volume and you get syringes, whether it's from your care provider or from your pharmacy,
Yep.
you can store this colostrum in the freezer and bring it in to the hospital with you. And
Yep.
then it's so valuable for women. They just have this confidence going into their
Yep.
breastfeeding journey, being like,
Yep.
I've got colostrum. I've already got it there for my baby and I know how to get it out. So I
Yep.
think that is just so incredibly valuable. And colostrum, it's thick, it's sticky. So we really need to tell women if it will only probably be very minimal little drops. So
Yep.
don't expect it to be like milk. But this is so highly nutritious. It really helps coat the baby's tummy and
Yep.
really set up their gut health. And it can be really valuable as well for if anything did happen post-birth, if mum and bub had to be separated, or
Yeah.
then your partner could always give the baby the colostrum, or if the baby was needing top-ups and things,
Yep.
then so lots of benefits to antenatal expressing, I find. What
Brilliant.
about you? Do you find the women who do it, do you find that's helpful for them?
Absolutely. And a lot more of my patients are doing it now that you're looking after
Great.
them as well. And you're right, they just come in knowing they've got something there to give to their baby when it's
Yeah.
born. And if they have difficulties, feeding initially, I think it's a lot less stressful for them knowing that they've got that there as backup, which is really, really great.
Yeah.
Are there any particular groups of women that you find it or that you recommend it for in particular? Is it known to be more beneficial in women with gestational diabetes or anything like that?
Definitely.
What's sort of your, yeah.
Yeah, absolutely. So particularly gestational diabetes women, because we know that their babies are going to have blood sugar level monitoring, post-birth. And, if they do need a little bit of a top-up, amazing, you've got it there. So that's really great. And if your baby's sort of measuring small any sort of indications where you think that your baby might need to have those top-ups, then, that's really, really beneficial for them.
Definitely. And I see there's a question here about whether or not it can still be brought in to the hospital during COVID times. And the answer is yes. So a number of my patients have used it this week. So definitely able to be used,
and I
which is
know
great.
one said it was her savior. So
there
one
you
of
go.
your patients said that to me. So I was
Perfect.
like, okay, good.
Brilliant. Fantastic. Well, we'll keep encouraging it then, my friend. Good. So next thing, let's move on to the birth now. So a woman's had her baby's been born, and the baby is with mum for the first time. What at that point in time can a woman do to make sure that breastfeeding is initiated properly and gets off to a good start?
Yeah, absolutely. So number one thing is doing the earliest possible skin to skin contact with your baby. So ideally in a birth, if everything is all well and good with mum and baby, the baby should go straight to the mum's chest.
Perfect.
And stay there. So basically having that skin to skin contact with your baby will really help regulate your baby. So it can really help you, they'd put a warm blanket over the top of you and your bub, and it can really help stabilize baby's blood sugar levels and temperature and breathing, and it just really helps calm both yourself and the baby, and as well as the added benefits of helping stimulate your breasts and really help promote that bonding and really get those hormones going, which is so important. And then what I always suggest to women, sometimes they get a bit excited and they're like, oh, I need to put my baby on my breast, and off we go. And I always try and say to women, have your baby there onto your chest, and really then just sort of, take some deep breaths, look at your baby. You'll notice that, a lot of the time, if your baby is quite alert, your baby will start to look at you, and then they will start to probably do what we call, the early feeding cues. So if they're doing that, they might sort of lick your chest, bring their little hand up, and they start sort of searching, and you want to sort of lie back and sort of have your baby there and really see if your baby will do what we call the breast crawl. So the breast crawl is where babies can literally sort of crawl their way to the breast, and they find the breast through often your areola is a bit darker, and that can help guide them, but also you have what we call Montgomery glands that really help to secrete a fluid that is familiar to the baby, and really so the baby's using their innate senses to make their way to your breast. So that's where we really want to give that time for your baby to really sort of orientate themselves to the breast and to see if they can make their way there. And there's so many videos about this on social media at the moment. I know I've got one on my page, and it's incredible. So watching your baby actually do that and giving your baby that time to do that if your bub isn't doing that, you know, and if you've given it sort of, you know, an hour or so and your bub's sort of not doing that, then, you know, getting the midwives to help you and really start to initiate that first breastfeed, and just getting them to give you a hand. But I always say as well, don't stress. If your bub isn't, like if your baby is a bit sleepy, and not super interested in feeding, then that is when we would go to colostrum. So that's when we would, you know, give your baby a little bit of colostrum. And sometimes that's just a little bit that they need to go, and then, you know, want more and want to go on. But even if, you know, even if you can't, you know, try and give colostrum, and even if you're still not getting any, leave your baby. If everything else is all good, leave your baby skin to skin. And just knowing that right from the start, once your baby's born, we are wanting to do regular stimulation of your breasts. So, you know, ongoing, just doing that regular stimulation and doing that skin to skin contact ongoing as well is also really important. You know, everyone's really good at doing it at their first feed, and then women don't seem to do it enough after that. But I'm like, if you can every feed, you know, strip your baby down, put your baby onto your skin.
Excellent advice. Brilliant. There's a really good question here from someone wanting to know about what you can do about skin to skin if you have a cesarean section. Now, it's a tricky question because we always like to encourage it, but theatres are pretty cold places, and a lot of the time it can affect sort of the temperature of the baby. And you know, we've got to be mindful of, you know, achieving the right balance. And as you say, you know, if you're going to do it, it's really important to the baby put, you know, under a warm blanket and everything. But it can be a bit more difficult in that scenario. And I certainly know some paediatricians across a number of hospitals who, you know, worry about the babies getting a bit cold when they do skin to skin in an operating theatre. What's your general advice for women having a caesarean section where they may be told, look, given other risk factors, and we think it's not ideal for your baby to be skin to skin, what can they do to try and initiate that sort of thing as soon as possible?
Yeah, for sure. So again, you know, if they can possibly do that skin to skin, and I know sometimes it is hard when like the baby's quite up like this. I've got a little baby like
good.
Right here.
Keep no, it's really useful. Good.
I'm so used to doing that with teaching women, and I've got my
fantastic.
breast, I've got my baby here. So doing that if possible, and having the warm blankets, and they have got, you know, the partner can have their hand there. So they if it is right, then they can try that. But sometimes women as well do feel quite sick after, you know, they can feel a bit nauseous, and they just sort of don't want their baby to be there. So I always say, you know, if your partner's comfortable, do get the baby to do skin to skin with the partner. That's a really beautiful thing to do. So again, if your partner's comfortable, do skin to skin with the partner, have warm blankets around them. And then when you go to recovery, that's when I always say to women in recovery, put your baby onto your chest then, and that's when you can try and do that breast crawl. So give that a go in recovery. And most of the time after a cesarean, they do sort of take the mum and the baby together on the trolley to the postnatal ward. And the baby will come off while they're transferring the woman. But then once the woman's, you know, in the bed, then again, putting baby straight back on. And I always say to women, like, once you've had a cesarean, you've got a lot of obs coming your way for the next few hours. So long as you're alert and you're happy to, leave the baby there skin to skin as much as you possibly can.
Brilliant. And I think that sort of answers another question that's come up, you know, how long should skin to skin continue for in terms of days, weeks, months after the baby's been born? Should it be at every feed? So I think what you're saying is just the more the better, essentially. Is that right? The more the
better. Yeah. And to be honest, I've actually found as well with COVID and with the lack of visitors, I found that women have sort of keep saying to me, slight silver lining is that they feel really comfortable to do that skin to skin with every feed. They don't have to have their bra on. They've just got their baby there. They can do that skin to skin, and a lot of women are actually, you know, enjoying that part of it as well.
Definitely. And I echo that completely. A lot of the midwives at Francis Perry have been saying to us over the last few weeks and months that women have been initiating feeding so much more successfully because they haven't had, you know, the visitors in and out and the distraction. It's actually been, you're right, sort of the silver lining is a very good way to describe it. But, you know, it's something that's come out of what's been a very challenging time otherwise has been that feeding's been a lot more successful. So that's excellent. So, so we've had our skin to skin, breastfeeding sort of been initiated. when a baby's being fed, how long should a baby be fed for? So for how long and sort of how often? This is the thing
Yeah.
that I always get asked by women, when do I need to feed my baby? Every time the baby rouses and cries, should I be giving it,
Yeah.
food? What
Yeah.
should I be doing? How do you know that you're feeding a baby properly?
Yeah. Okay. Great question. So basically, we really encourage to what we call breastfeed on demand. So
Yeah,
basically that means when your baby is showing you cues. So again,
yeah,
it's the early feeding cues. It's the
yeah,
starting to sort of wake up and wriggle, starting to
yeah,
sort of, do the tongue and look around and start to kind of head bubble and all
yeah.
that sort of thing. So when your baby is doing that, that is when you should feed your baby. It doesn't mean like
Great.
if it's been an hour or 2 hours, we try and really recommend feeding on demand. So when your baby wants to feed, and
Yeah,
again, then stripping your baby down and doing that skin to skin. Um, it is very regular feeding though. So if your
yeah,
baby isn't waking for feeds, it's just important to know that we do want babies to feed 8 to 12 times in a 24-hour period. So it is a lot
right.
of regular feeding. So it
It
is sort
is.
of essentially, 2, 3, occasional 4-hour feeding this for an exclusively breastfed baby. Their tummies are tiny, so they fill
Yeah,
up quickly and then they digest quickly. So this is where
yeah,
it's about the expectations and just remembering that in
for
these early
sure.
days, regular feeding is really important. And then again, it's about talking, you can talk to your midwives and say, okay, I often say to women, if your baby hasn't fed in how many hours, if it is getting to that 3 to 4 hour mark and your baby hasn't woken, then,
Yeah,
set your alarm and then strip your baby down, put your baby skin to skin, see if they will
brilliant.
start to sort of do those cues. And
Yeah,
then you can call in the midwife and get the midwife to help you
awesome.
with attachment and things like that. So
Perfect.
essentially 8 to 12 feeds in a 24-hour period is what we recommend. And
Hmm.
in terms of sort of how long to feed your baby, so again, it's basically watching your baby. So we don't really go by times anymore. We don't
Okay.
recommend getting you to watch the clock. And this is
Yeah,
when I'm talking about this, I'm talking here for a healthy term baby. Obviously, if your baby was a lot smaller or prem or something like that, then you will be guided by your health professionals. That might be a time where they might sort of put more of a time limit on it.
yeah,
However, for a healthy term newborn, we want to watch them. So I always talk to women, and especially when their milk is in, it is really important for women to know to really sort of watch for the suck. So once their baby is
yeah,
on and attached well and sucking, I sort of tell them to watch out for that suck, swallow, breathe, and that they'll hear the swallow. And the midwives as well will teach women about what to listen out for the
yeah,
swallow. And I always say as well, really feel your breast before the feed. So really
yeah,
get in the habit of having a really good feel of your breast just before you pop your baby on. And then once your baby is attached and attached well is crucial,
yeah,
then once they start sucking, then you can really watch them do that quite rhythmic sucking.
yeah,
And then you'll notice in terms of when a baby is finished, they'll
yeah,
either potentially fall asleep, which
yeah.
particularly in the early days is very common that they do just
It
fall
is.
asleep.
Yeah,
Or they will just take themselves off, which is great, but they don't do that as much. More
no.
so what they tend to do is they tend to go to more of a comfort suck. So rather than
Yeah,
doing that really good sort of suck, swallow, breathe, that good deep rhythmic sucking, and they're quite alert, and then they start to sort of drift off a little bit, and you can see that their eyes sort of close and they sort of tilt back, and that's when they often come to more
yeah,
the edge of the nipple. And instead
yeah,
of doing those good rhythmic sucks, they sort of tend to go to just this tiny little sucking, and
yeah,
it will often then hurt because they've
yeah,
brought the nipple forward. And so that's when that's when you can take your baby off, and either your baby will be like, oh hey, I was feeding and want to go
yeah,
again, and that's
yeah,
fine. And again, we're going by the baby. But
yeah,
often they'll purse their lips and do a little stretch, and then
yeah.
that's when you can do the change and off for the second side. And another
Perfect.
thing to note about this is when your milk is in, it is really important, as I said before, to feel the breast. So as you felt the breast before the feed, and when your milk's in, it will probably feel, quite firm and quite hard and full.
Yeah,
And then when the baby sucks, we want to try and make sure that the breast is feeling empty.
great.
So, for continuing to build supply, we want that emptying of the breast. And
Absolutely.
also as well to, prevent blocked ducts and things like that. It's important that we try and drain the breast as much as possible. Um,
Yeah,
so yeah, so that's sort of in terms of knowing sort of how long to feed.
yeah,
Yeah, and how often to feed, go by your baby. But again, if there are some challenges that are presenting, then
Yeah.
just know that you will be guided by your health professional in that
Brilliant.
situation. Yeah.
Excellent. Now, obviously, there are sort of lots of challenges that are faced by women who are trying to breastfeed, you know, especially for the first time. And the things that
Yes.
we hear about a lot of, you know, a lot of pain when they're feeding. A lot of women have
Yeah.
really quite excruciating nipple pain at times.
Yeah.
How can this be A, prevented, and B, for women that do get bad nipple pain, what can they actually do about it?
Yeah, absolutely. So prevention is absolutely key.
Yeah.
So that's why I always say to women, and this is again why that antenatal education is so important, because I
Yeah.
always say to women, like even from that first feed, if your baby's
Yeah.
done that breast crawl and the baby's gotten on and then they're just
Yeah.
on the edge of your nipple and you're like, oh, this is hurting,
Yeah.
take your baby off. So
Right.
golden rule, if it's pinching, hurting, burning, shooting pains, anything like that, if it's really uncomfortable, then it's really important to take your baby off. So we recommend,
Okay.
putting a little finger in the baby's mouth and really sort of
Yeah.
breaking the suction to
Yeah.
help them come off, because you don't want them to really sort of take your nipple off with them. So
Absolutely.
yeah, so really trying to break that suction and letting the baby go off, and then the baby, and then sort of trying to reattach the baby.
Yeah.
So with nipple pain, yeah, prevention is key, and really being really diligent with that, keep
Yeah.
trying and keep working with midwives and
Mm-hmm.
professionals to try and help get that deep latch if you're struggling. I always say to all of my clients and your clients that to feel the roof of their tongue with the roof of their mouth with their tongue. And at the
Yeah.
start, it's quite hard at the front, and then as you work your way back, it goes to a soft palate.
Yeah.
And
Yeah.
obviously, thankfully, a baby's mouth is a lot smaller than ours, but I
Yeah.
talk to them about really they really need to sort of try and get their baby towards that soft palate.
Great.
So
Yeah.
right at the back, so that they've
Yeah.
got a really good deep attachment,
Mm-hmm.
is so important, because if the baby's on nice and deeply, count
Yeah.
to 10, because definitely, your nipples will probably get a bit, tender
Yeah.
and it'll be a bit tender for the first 10 seconds. And
Yeah.
as they sort of navigate the nipple into the right spot, and then once they are
Yeah.
sucking,
Yeah.
then that is when it should feel a lot more, it should feel comfortable. And that's what I
Great.
think is really important to send the message out to women, is that when breastfeeding is right, it should be comfortable. So, and I know
Mm-hmm.
that nipple pain is a huge challenge for women, and it's so real. And so that's why, again, it's, trying to really get them to keep working on that latch. I
Yeah.
think we shouldn't normalize, that cracked bleeding nipples that women
No.
talk about. It's common, yes, but it's not normal. It
Not
means
normal.
that
Yeah.
things aren't happening right, and it's going to
Yeah.
lead to so many more issues. So really important for women to know, if it's hurting, take your baby off, get help, get support, try and get that deeper latch. And
Yeah.
I always say to women as well, after you've had a feed, then use some of your magical milk or colostrum,
Yep.
hand
Great.
express a little bit, rub it around, and
Great.
just let your nipples air dry for a little bit,
Yeah.
and that can really help as well. So yeah, so they're my top tips with nipple pain.
Fantastic. And for women that have sort of, you know, cracked, bleeding nipples, etc.,
Yeah.
should they continue to be feeding? Are there things that they can do in between? I mean, I see it all the time. Women who just say it's really
Yeah.
painful. I've got these cracked, bleeding nipples.
Yeah.
And, you know, what's the balance of getting them to keep feeding through that? And what can they do in between to try and help it? Are there
Exactly.
compressors that can be used that are helpful? Is, you know, ice useful? What sort of things do you generally recommend?
Yeah. So look, again, I would say that when they're really painful and really bleeding and cracked, I
Yeah.
really highly
Yeah.
recommend getting someone to work with you and to look
Great.
at your nipples and to
Yeah.
assess your nipples and to
Yeah.
assess, we have to find the cause of that nipple
Yeah.
pain. That's the first thing. So really getting someone to
Absolutely.
really work with you.
Mm-hmm.
And then in terms of what to do if they are at that stage, again,
Mm-hmm.
it is working with a lactation consultant or a midwife to work out the appropriate plan for you. Sometimes women will need to rest their nipples and express and things like that. But again, I highly suggest that you work with someone to look
Great.
at your individual circumstances when
Perfect.
you get if you do get to that point. That's really important, because sometimes we can
Perfect.
do some Band-aid sort of approaches, and we just sort of, are like, oh, we just need to treat the pain, but then it just can escalate. So yeah.
Definitely. Find the root cause so that you can treat that as a primary treatment. Excellent. And talking about that, you've spoken about, that quite superficial attachment being quite traumatic to the nipple, and it's that deep attachment that is quite important. What can be done to encourage that deep attachment? And if you can't get it, what can you do to help?
Yeah, definitely. So yeah, if you are trying everything and you cannot get your baby to attach, which it
Yeah.
happens, it really does
Yeah.
happen. I,
Yeah.
you know, I say to, again, it's working with the midwives and lactation consultants to try and help you, figure
Yeah.
out, they can really watch your baby, watch you,
Yeah.
and they can try and help you sort of figure out what's happening. So that's
Yeah.
really important. Going back to skin, if you haven't been already, if your baby, keeping your baby skin to skin, again, just helping them reorientate to the breast, doing
Hmm.
so much of that skin to skin is so, so crucial. But also, if you cannot feed, then so important to express and maintain your milk supply. So
Yeah.
breastfeeding works on supply and demand. So, as I said, once your baby is born, you need to stimulate your breasts regularly
Yeah.
to try and help bring your milk in. So, we ideally want your milk to come in ideally about sort of day 3. Sometimes it's sooner, sometimes it's later, but your baby, if your baby is not feeding well, then we need to keep stimulating your breast to bring in your milk supply. And I
Yeah.
always say to women, if your baby is not attaching and you're really struggling with that attachment, to take a few deep breaths and just try and relax and think, you know what? This is why we say it can take 6 weeks to establish breastfeeding. Sometimes it
Absolutely.
doesn't all happen
Yeah.
overnight, and these challenges are real and they happen. So in the meantime, get that supply in. If you can just have a good milk supply and keep expressing and keep getting to that supply. Sometimes we do
Yeah.
just need the baby to get, have some of that expressed breast milk and get bigger and stronger,
Yeah.
and then work their way back to the breast. So, there's a
Yeah.
whole range of things there, but yeah,
Yeah.
definitely getting, having that support and working on your supply. And
Yeah.
yeah, trying to, I know it sounds so, yeah, it's so easy to say, but try and stay as calm as possible.
Yeah.
We need oxytocin to help really release that breast
Yeah.
milk. So if you're really, and I see it all the time,
Yeah.
I find more women are sore in their shoulders than
Yeah.
in their, perineums or if they've had a
Absolutely.
Caesar, they're
Yeah.
sore because they're like this. They're trying to attach their baby
Absolutely.
and they're
Tense.
so stressed.
Yeah.
And I always say, like, just how we talk about to, set up your labor environment for your oxytocin environment. I'm like, set up your breastfeeding environment, have nice,
Great.
nice light, like, like more mood lighting,
Yeah.
have your little
Yeah.
LED tea light candles if you're in hospital, have
Great.
some soft music on, get someone to, give you a massage, try and calm down, do that skin to skin, and yeah, keep working
Perfect.
on your supply, and we can work your baby back to the breast. So yeah, give yourself
Brilliant.
time.
Brilliant. And are there any
Yeah.
feeding positions that you recommend as being most helpful with attachment, or is it really on a case-by-case basis? I remember, when we became new parents, lots of
Yeah.
different midwives would show us different techniques for holding the
Yeah.
baby, some across your
Yeah.
lap, others in the football
Yeah.
hold. I just remember all these different things.
Yeah.
Is there
I
one that's
know.
best, or is it just different for every woman?
Yeah, so and I do hear that so much from
Yeah.
women, and women always say to me, but everyone has a different technique. And I always
Yeah.
say, think of it as there's no one right way. Think
Great.
of it as, have that positive mindset and think, great, there are so many ways I can do this. I'll
Yeah.
try this way, and if that doesn't work, I'll try that way, and then
Yeah.
and keep trying. It completely, I definitely love, like, for the baby to do a bit of that sort of
Yeah.
baby led, working
Yeah.
their way to the breast. But again,
Great.
every woman's breasts are different.
Yeah.
For some women with bigger breasts, the football hold works beautifully.
Right.
But different breasts. Everyone's
Absolutely.
breasts are completely different, and your
Yeah.
breast can be different one to the other as well.
Yeah.
So that's why it's just about, it is about trying different positions and
Yeah.
seeing what works for you.
Perfect.
Yeah.
And one other question which I'm going to ask, which came up there, I know it's a little bit contentious, so feel free to
Yeah.
deflect
Yeah.
slightly, but it's about
Yeah.
tongue tie. For women that are
Yeah.
having a lot of difficulty with attachment, is there a role for at least assessing for a significant tongue tie? What's your sort of take on it?
Yeah, definitely. So again, that comes back to that whole, if the baby is unable to deeply attach, then
Yeah.
I really recommend working with someone who's,
Great.
a lactation consultant. That's when you
Yeah.
need a lactation consultant consult,
Yeah.
and there's all the different, ways that they can really assess the baby,
Great. Yeah.
and see for a tongue tie. Like if a baby's got you can visually see a little bit of a tongue tie, but they're feeding
Yeah.
perfectly and there's no pain, then that might be okay. But obviously, if
Yeah.
you're having, they really can't get that good
Yeah.
attachment, you're having all these issues, and yeah, absolutely having that lactation consultant visually assess your baby, and watch you do the feed, and make that assessment is
Perfect.
crucial. Yeah.
Brilliant. Good. Now I'm going to move on shortly to pumping, but there's a
Yeah.
question that's just come up before, which I think is a really good one, and I wouldn't mind you touching on it. And
Mm,
I think it relates more to women who have a lot of nipple pain with really sort of cracked, sore nipples.
yeah.
Nipple shields, is there a routine role for them? What's your take on shields? I know they're, again, a
Yeah.
bit contentious.
Yeah. Yeah, exactly. So definitely, nipple shields can definitely have a very they have their place. They absolutely
Yeah.
have their place. So for women who
Yeah.
have, very inverted nipples, where the nipple
Yeah.
doesn't come out with any
Yeah.
stimulation,
Yeah.
then often the shield is often needed.
Yeah.
So again, with a nipple shield, it's about working with someone to, to get it on. You have to actually have your milk sort of really transitioning and being in to flow
Right.
through the shield. So colostrum,
Yep.
it's not something you can start right from the start, because
Got it.
obviously colostrum is very thick and very sticky. So
Mm-hmm.
it's very hard for babies to suck that
Got
out.
it.
So
Yep.
so it has to be at a certain time. And again, so that's what they're designed for. Women often use it as oh, my nipples hurt, I'll put a shield on, and
Yep.
away we'll go. And then that's when they can cause issues, because again, we're
Yep.
not sort of going back to the root cause. So
Definitely.
again, that's where I always say, definitely they have their place. But some women, if they truly have very inverted nipples, might have to use them ongoing. But then
Yep.
they'll usually need a bit of a plan in place, because sometimes it can impact the milk supply. So
Right.
so working with someone to come to have a bit of a plan.
Yep.
But yeah, it's more just that we don't want to use them as sort of a band-aid approach. So yeah, if you're introducing a nipple shield, yeah, it's about
Yep.
having that advice about, okay, let's see why we need it, and how to kind of make a plan
Excellent.
going forward.
Perfect. Great. Thanks, Amber. So let's talk a little bit about pumping now, and a couple of things
Yeah.
about pumping. So when should a woman pump?
Yeah.
And, what pump is the right pump? Should they be bought before
Yeah.
the birth? Do you need it from the moment you get into hospital or you get home? Tell us a little bit about pumps.
Yeah. Yeah, great question. I think so many women here like, oh, but women pump. Like, when do I pump?
Yeah.
And again, so if your goal around breastfeeding is to exclusively breastfeed, then
Yeah.
we do recommend, if everything's going really well, your baby's attaching really well, and sucking well, and your milk's come in, and it's all working well, then
Yeah.
we ideally recommend not pumping for the first 6 weeks.
Right.
So reason being is because it works on supply and demand. So we
Yeah.
really want, sometimes women's milk comes in and they get quite a bit of a supply, in terms of they have to really manage that, and it's taking
Yeah.
time for their
Yeah.
baby and their breast to regulate. So we want that regulation to happen. So that's why
Good.
ideally that first sort of 6 weeks, if we can get that
Yeah.
supply sort of regulated, and also as well, it's a very different sucking action
Yeah.
on the bottle to the breast. So we really want the baby and the mother to be really confident with their supply, with their sort of supply and their feeding, before we sort of introduce pumping and bottles and things like that. That is if
Good.
it's all going really well. However, as I said before, if there are any challenges,
Yeah.
so particularly around 48 to 72 hours, that's when we're starting to look for jaundice, or and see if jaundice is coming on, or if
Yeah.
the baby's sort of lost more than 10% of their birth weight, or the mum's milk's not coming in, things like this. So any sort of challenges, then women will be guided by their midwives and pediatricians, that potentially, that they will have to introduce a pump at that point,
Right.
if their milk's not coming in, or if their baby's
Yeah.
not feeding. So
Yeah.
basically, if it's required, then that's when we do need to pump. And again, like I said, even if your baby's not attached, you just can't get that deep attachment. Obviously we need to feed your baby, and we need to do that regular, emptying of the breast.
Yeah.
So that's usually when we would introduce a pump. And
Great.
again, when we do that, it is about sort of talking, if your goal is to get back to exclusively breastfeeding, then, it's about sort of getting your supply in, and keeping on getting that weight on the baby, and whatever those issues
Great.
are, sort of allowing those issues to resolve, and we continue to keep working on getting your baby back to the breast.
Excellent.
And that's if that's their goal. Obviously, some women want to pump and give their
Yeah.
baby bottles, and it's so individual, and it's about what works for you. And in
Absolutely.
terms of with buying a pump and all that sort of thing. I really think it's an individual decision.
Yep.
If a woman is like, I'm having a couple of babies, I know that pumping's in my plan, whether
Yep.
she is someone who wants to, give bottles
Yep.
throughout it, that
Yep.
she wants to pump and she wants to, or she's going back to work or she's going to
Yep.
events and things like
Yeah.
that, then it
And there
might
are a
be
lot of
worth
women, I think, who say, overnight, just to have a bit of a sleep, I'm going to pump, I'm going to let my partner give the baby one bottle overnight.
Yeah,
And that's just my sort of
for sure. A
respite.
lot of,
Yeah.
yeah,
Yeah.
absolutely. So yeah, if pumping is in your plan,
Yeah.
and that's what you want to do, then, it might be worth going out and getting a really good pump.
Yeah.
However, I do say to women, it's not it if you're like, well, I don't know, like it's my first baby, I don't know how it's going to plan, and getting a
Yeah.
really good pump, it's
Yeah.
expensive.
Yeah.
So I always say to women, if you are needing to pump for that, so again, there's two kind of avenues. So if everything's
Yeah.
going well and you don't need to, but if you do need to, I highly suggest hiring the hospital grade electric pumps, those
Great.
yellow Medela Symphony
Yeah.
pumps. They are amazing. They're brilliant. And especially if you are on that plan, it's time consuming. It's so
It
time
is.
consuming. So you can
Yeah.
hire these from local pharmacies, and
Yeah.
and on the Medela website, you can get them as well. And then they're powerful, they're efficient. You can
Great.
double pump, 10 to 15 minutes and then you're
Yeah.
done. And
Great.
that's really brilliant for your supply. So I highly recommend that. Yeah, so that sort of, it does sort of depend on your goals, but definitely it's not essential. The
Perfect.
huckers are really sort of, I don't know if you've heard of the hucker pump, but lots of women are being gifted hucker pumps for their baby showers and things like that. And
Yeah,
so
I've seen them.
basically, yeah, so it's a little like silicone. They're like $35 or something like
Mm-hmm.
that. And it's a little
Mm-hmm.
silicone pump that just sits on your breast, and
Yeah.
it works by just very gentle stimulation. And so
Yeah.
what you can do is you can squeeze the bottom, and then it can just get a little bit of stimulation happening. And for
Right.
some women, I think they can be so brilliant. Like women who
Mm-hmm.
are like, who struggle with engorgement and things like that, they can be brilliant because they can have their baby on one side feeding, and then on
Yeah.
the other side, they've got their pump on, their hucker on, and they can just, that can help relieve that little bit of their breast. And
Brilliant.
that can be really great. But again, it is always about, is this going to be the right fit for you? And like I
Yeah.
said, a lot of women are being gifted them.
Yeah.
And the reason for that is because some women make the perfect amount for their baby, and they don't really, they don't get much.
Yes.
And because it's a
Yeah.
visual thing, it can really deter them and think my supply is not enough because I'm not getting in there.
Right.
So again, I just like
Yeah.
to sort of inform women about about huckers. I think that and pumps, like, those little silicone ones that are
Yeah.
like that,
Yeah.
just about, I think they can be really great, but they're not for everyone.
Perfect. Excellent.
Yeah.
Talking briefly about formula,
Yeah.
when would formula need to be introduced? I certainly know that, as I say, every woman, makes different decisions, but for women that want
Yeah,
to
definitely.
exclusively breastfeed, there are some that are quite adamant that they don't want to use any formula.
Yeah.
And often when, they're recommended by a midwife or pediatrician that it might be warranted, it can be quite a challenge for them. So in
Yeah,
your opinion,
definitely.
when
Yeah.
would formula need to be introduced?
Yeah, for sure. So basically, we recommend for women who are wanting to exclusively breastfeed, if it is
Yeah.
medically indicated,
Yeah.
then, formula, if they don't have enough express breast milk, and if they don't, sometimes it can just take a little bit more time to get that
Definitely.
breast milk in. And,
Definitely.
if it's medically indicated, if your baby is, has lost more weight,
Yeah.
if your baby is, a bit like lethargic or
Yeah.
not, or jaundice or
Yeah.
things like that, the pediatricians are having that chat to you and saying, look,
Yeah.
this is what we need right now. We need to
Yeah.
sort of get that weight onto your baby,
Mm-hmm.
and, get your baby bigger, stronger. And that's when, in the meantime, that's when you keep working on your supply. And I
Yeah.
do suggest as well, just giving the amount that is sort of the pediatrician will tell you, okay, this is how much we want you to be giving.
Yeah.
If you can, a cup or a syringe is great to do.
Mm-hmm.
So again, asking them, is this right for my baby? Can I do a cup or a syringe of the formula? And again, it's about having a plan in place. Okay. Well, the thing to know about formula is that once, and this is why we say to give, if medically indicated, if
Yeah.
you're wanting to exclude, if your plan is to exclusively breastfeed, because
Yes.
formula takes longer for the baby to digest. So
Mm-hmm.
what that means is that sometimes if you're sort of going to do the next feed, and you know, we
Right.
want to stimulate your breast, it can just take that a bit longer for your baby to digest the formula. So
Sure.
you know, so the more formula we give, the more
Yep.
it can impact your supply. So that's why it's just about having that plan in place, saying, okay, you know, let's keep doing the skin to skin, let's keep trying, let's keep working on getting our milk supply because
Awesome.
because once you've got the supply there, if your baby's needing however much of the formula, then you can give the express breast milk, and then that's when you can swap that in, and then you can come off that plan of, you know, then once your baby's taking more from the breast, they won't
Yep.
need the formula as much. But again, like I said, this is really about women, if women are really wanting to exclusively breastfeed, and you know, I just think, you know, some women, you know, doing a mixed feeding for them, that's what they're wanting, and I just
Yep.
think we need to, as a society, be so just gentle on each other, and just
Yep.
everyone, you know, it's whatever sort of works for you.
Beautifully said.
That's really important, you know, to
Yep.
know that, you know, we're supporting all women and whatever is right for
Yep.
them and their choices. But what I like to really educate women about is if they're
Yep.
wanting to exclusively breastfeed and they're not wanting
Yep.
to give formula, just to know that that is how the formula will impact, so that they
Yep.
can have that plan in place, if that makes
Excellent.
sense.
Very well said. It's obviously a very sensitive area for a lot of people, and I think you're
Yeah,
navigating it very, very well. So you're
yeah,
doing, you know,
it's
I think all the advice you're giving is really reassuring for so many people out there, which is
and I
just
just
wonderful. But it's a difficult topic to talk about
it's
because
so,
every woman
yeah,
is different, and every pregnancy is different, and every baby is different, and it's
totally,
about
yeah.
individualizing care, and I think that's really
Exactly.
important.
Yeah, and it can be really hard for women if they really didn't want to give formula,
Yep.
but you know, and then they ended up having to mix feed, but that wasn't their
Yep.
plan. Like, you know,
Yep.
and there are some women, every woman is just so different, and their
That's
circumstances are
correct.
completely different, which is why we just
Yep.
have to give women the education, give women the
Yep.
support, and then just all be really gentle with each other and support each other, you know,
Couldn't agree
no
more.
matter what they're doing. Yeah.
Perfect. Well, not too many questions left for you. We're almost done, my friend. The next one is about something which I think occurs really commonly, and it's really problematic for a lot of new mums, and that is blocked
Mm,
ducts and mastitis. So
yes,
the
yes.
management of mastitis itself is, I think, something for another time because it's really
Yeah.
huge. But essentially,
Yeah.
prevention, again, I think is the key.
Yes. So
Okay. And
important.
how
Yeah.
can women avoid getting a blocked duct? And how can
Yeah.
women avoid getting mastitis?
Yeah, for sure. So basically that's where the whole breastfeeding on demand comes in. I think the more
Yeah,
women try, and you know, some women really try and go on routines and things like that. And again, if they're not medically indicated,
yeah,
trying to go with your baby, because again, your breasts and your baby are going to work in flow with each other.
yeah,
So that's going to be really important for mastitis, and also
yeah,
and blocked ducts, and
yeah,
also as well, really again, feeling your breast before the feed, and putting your baby on, and really ensuring that your baby is emptying that breast. And when I say
yeah,
empty, your breasts are never going to be fully empty, but once your milk is in, they should feel softened, and you will start to know the difference. And again, it's asking the midwives the questions, or the maternal child health nurses, like, you know, about that,
yeah,
if you're not sure. So yeah, basically feeling your breasts fill, and then allowing your baby to drain. So it's when women do, you know, again, like 10 minutes each side or something, and they've got these full breasts, that's when we can get
yeah,
into trouble
yeah,
with blocked ducts and things.
yeah,
So yeah, really trying to empty the breasts as much as possible, and
mm-hmm,
feeling for them. So really
yeah,
feeling for lumps is so important. So that's why I say to women,
yes,
feel your breast before the feed, know what it feels like, know the lumps, know the firmness. And then once your baby has fed, and even towards the end of the feed, like if your baby's starting to slow a little bit, then feeling your breast again and
yeah,
feeling the difference. And if you're thinking, oh, there's a bit of a lump there, then that's when you can do some sort of gentle massage
great,
with your thumb, just sort of, you know, just a little bit of a massage towards your nipple, because your baby sucking
mm-hmm,
is going to be the best thing at really sort of
yeah,
helping release that duct. And again, if you're feeling like it's persisting a little bit, heat, massage, keep feeding. I know it can be painful at that
yeah,
point.
yeah,
But you do have to, it's important to keep emptying your breasts. That's really important, because, and keep trying to get them to drain. And then again, if you do start to have like flu-like symptoms, fever, chills,
yeah,
if you're feeling unwell, you know, contact your care provider. But definitely by doing that demand demand feeding, feeling it, trying to empty it as much as possible,
Right.
then that's that, and yeah, breaking down those lumps.
Awesome. And I think it's about getting onto it very early. I think a lot of women leave their block ducts a little bit too long, and that's when we run
Yeah,
into trouble. But it's about really that early management of it, which I think is really, really
yeah,
important
definitely.
in terms of reducing the risk of, a severe infective mastitis down the track.
Yeah, completely. Yeah.
Excellent. So, sort of to summarize tonight,
Yes.
you've given us so much advice and information, but what are your top tips as a midwife
Yeah.
and, a breastfeeding expert for women who are planning to exclusively breastfeed to
Yeah.
enable them to set themselves up, in an optimal way so that breastfeeding is achieved as well as possible?
Yes, for sure. I'm just going to do little rapid fire ones because I know
Awesome.
I've spoken
Great.
heaps.
Perfect.
Antenatal education, setting up your support system,
Yeah.
skin to skin, early as possible, and as much of it as possible. Trying to do that breast crawl and keep trying to do that at subsequent feeds
Yeah.
is really important. Staying as relaxed as possible. I know that it's hard, but trying to stay as relaxed as possible, deep breathing, and really setting up your breastfeeding environment so that you
Yeah.
are doing it in a calm place is really important. Again, early prevention of everything. So if you are having challenges come on, getting onto things early is so important. Regular stimulation. So whether, ideally that's your baby feeding. If not, it's hand expressing, it's pumping to get that stimulation going. Just knowing that that's really important to really sort of, to bring your milk in. And hydrating, looking after you, eating, drinking,
Yeah.
all those sorts of things. And yeah, just basically trying to really go easy on yourself and trying
Yeah.
just to, know that sometimes it takes time and there are hurdles, and it's just about
Yeah.
getting over a hurdle,
Yeah.
and getting that support and doing and sort of getting through that hurdle, and yeah, just trying to go really gently on yourself, because for a lot of women it can be really challenging.
Brilliant.
Yeah.
Now, my patients are obviously so lucky to have you involved in their pregnancy and postnatal journeys. But I think there are a lot of women out there who, don't access you through my practice, but would be delighted and lucky to be able to get your help, separately is the word I'm looking for.
Yeah.
So for women who do want to have you involved in their care, to have you
Yeah.
help them with, antenatal sort of education or help in the newborn period, how can they access your help?
Yeah, absolutely. So, they can go over to my Body, Birth and Baby Instagram account.
Yeah.
They can send me an email. There's lots of information there about breastfeeding and about it's digital packages at the moment.
Yeah.
So they can send me a private message or go onto my website or send me an email through that Instagram page. And
Brilliant.
I'll even put up a little Q&A box as well, because
Awesome.
I think there were questions coming through, but I talk a lot.
Amazing.
So I can put up a little Q&A box, and if anyone does have any questions that I didn't see or that came through, then feel free to direct them there. And
Yeah.
I can do some privately and some on my page.
Absolutely brilliant. And I'll put a link as well to the Body, Birth and Baby Instagram page as well on my Instagram. I just want to summarize by saying thank you so much. My patients absolutely love you. I think they like you more than they like me a lot of the time.
No, they don't.
And I just can't
No, they
endorse you
love
highly
you.
enough. So for anyone that wants help
Oh,
with
thanks,
breastfeeding,
Scott.
please visit Amber's page. And I haven't even asked you yet, but I'm hoping that at some point in the next few weeks we can also do a talk on postnatal care as well, because I know that's something you do for all of my patients as well, and they benefit from it hugely. So we will speak very soon to organise that. But thank you once again for your time tonight. You've been absolutely brilliant. An excellent debut on for an Instagram Live, Amber.
You know how nervous I was about the Instagram Live. So now that I got the first one out of the way, we can do a few more.
Fantastic. I look forward to it. Thank you so much for your time.
Thanks so much, Scott. See you later.
See you, Amber.
Everyone.
Take care. Bye. Bye.
Bye.
Bye.